Hi everyone, just to get going here, I'm Sarah Higgins, I'm Technical Vet Advisor with MSD Animal Health, and I'm here today with Catherine Heffernan and Matt Thompson and Donald Murphy from MSD, and thanks very much for having us here today. Just to start off with, I think most people associate MSD Animal Health with the drug side, the biopharma side, so the vaccines, the antibiotics, the hormones and also some of the dosing products, but we also have two other components to the company. We have identification, so your tagging, for sheep and cattle. So what we're going to talk today about is bovine respiratory disease. And I suppose, what is bovine respiratory disease? Bovine respiratory disease really is an umbrella term, and I suppose a lot of people would really, identify it as pneumonia, but really pneumonia is when you have lesions, inflammation and infection in the lungs, while BRD or bovine respiratory disease encompasses upper respiratory tract infection and lower. So it's kind of an umbrella term. And why we're talking about it today is it's really, really prevalent in Ireland, and not just Ireland, across the globe. Bovine respiratory disease is the #1 cause of death of cattle greater than 1 month of age in Ireland, year in, year out. Cattle that are less than 1 month of age, so calves, the #1 cause of mortality is actually calf scour, and I'll touch a little bit about vaccination against calf scour at the end of this presentation as well. So in relation to bovine respiratory disease, as a farmer, what you should be focusing on is the impact of it. So a lot of people will think, well, okay, it's going to cost me the treatment costs, it's going to cost me the mortalities, the calves that I lose or the heifers that I lose because of a bout of pneumonia or maybe an outbreak of pneumonia, all the antibiotics you put into the animals and maybe anti-inflammatories and vet call-outs. But really and truly, farmers should be focusing on the long-term repercussions or implications from bovine respiratory disease. So we'll take, for example, heifer calves. The study was carried out on 214 heifer calves, and if they had a bout of pneumonia in their first 8 weeks of life, so where they had pulmonary lesions and obviously survived, in their first lactation they had a reduced milk yield of 525 litres. So if you had 5, 6, 7, 8, 9, 10 heifers with that sort of disease early in life, you could be down 525 litres in their first lactation with each heifer. Now, what causes bovine respiratory disease? Well, unfortunately, there's a list as long as your arm what can cause pneumonia in cattle in Ireland. But I suppose the main culprits, generally what happens is, not always, but in most cases, you get a primary viral infection. That then, I suppose, dampens the immune system, and cattle then will succumb to a bacterial infection. So for example, viruses will be, most of you become with IBR, which is caused by bovine herpes virus 1, also RSV, PI3, bovine coronavirus, and bacteria then that we commonly see in pneumonia case in Ireland is Mannheimia hemolytica, Pasteurella multisida, Mycoplasma, and then we have lungworm as well. Don't forget that, Dictyocallis viviparus, that can also cause pneumonia in cattle or respiratory disease in cattle as well. And I suppose from a farmer's point of view then, how can you go about controlling bovine respiratory disease? Now, unfortunately, there's no one, I suppose, answer for every farm. It's quite farm specific. But one thing about controlling respiratory disease, it's a multifaceted approach. Because I'm a technical vet advisor from MSD, we'll focus now a little bit on vaccination against respiratory disease. So what does vaccination do? Well, it primes the animal. The animals will produce antibodies once vaccinated. So when they come across these common culprits like RSV or PI3 or Mannheimia hemolytica later in life, they should be able to respond with antibody production and help fight infection and reduce clinical signs, reduce the severity, and reduce, I suppose, overall the clinical signs, but also mortalities associated with respiratory disease. So if you find you get an awful lot of respiratory cases, like clinical signs like snotty noses, coughing, a bit of a pant or a draw, high temperatures, calves off feed, off form, lugs, ears hanging or looking empty, Bovillus intranasal RSP live will be a good option there. It's up the nose, 2 ml squirt up the nostril. It kicks in within 1 week for RSV and PI3 for the onset of immunity, and then it provides protection for 12 weeks. So you're getting them past that high risk critical period in that calf's life. And just before I pass you back there on to Catherine here now to discuss SenseHub, I'll just briefly mention as well the importance to provide protection against calf scour. We know how shocking or a nuisance calf scour is in any place. The time alone, tubing, feeding, giving electrolytes to calves, cleaning pens and all that. But from an MSD point of view, we've 2 vaccines on the market for covering against pneumonia, or covering against scour, Bovillus rotavirus corona, that provides protection against rotavirus, coronavirus and E. coli. Again, it's been around for a long time. I'm sure a lot of you here use it already, but it has to be given to pregnant heifers and cows 12 to 3 weeks pre-calving. But we have a new product to our portfolio that came last year, Bovilis cryptium, and it's protect against cryptosporidiosis, so Cryptosporidium parvum in baby calves. And that also has to be given to cows and heifers that are in calf 12 to 3 weeks before the calf. But what's important to note about that vaccine, it's a bit different to Rotavirus Corona. In the first year, they need 2 doses, a primary course. They need 2 shots, 4 to 5 weeks apart. And for labour-saving reasons, it's licensed, so it's got a concurrent use claim. You can give the cryptium vaccine and the Rotavirus Corona vaccine on the same day to your cows. And I would recommend giving it opposite side of the neck. It's 2 mils. Cryptium is under the skin, and Rotavirus Corona used to be just into the muscle, but it's now licensed under the skin or into the muscle as well. So I'm just going to pass you over now here to Catherine, and she's going to discuss technology side SenseHub in MSD.
So I'll give you a quick whistle-stop tour through our SenseHub ecosystem. But typically, SenseHub, I think, over the last couple of years, would be known for its monitoring technology, so the collars and the cows, and that's what is most popular out there and has been most adapted over the last number of years. So basically, our monitoring technology is essentially, it's a collar that the cow wears. It monitors the animal every minute of every day, and it measures 10 different animal behaviours. And typically, we're talking rumination, eating, activity, and there are many more, but these are the main 3 that we speak about. So you're getting this information from the cow every minute of the day. We put a base station in the yard, so typically when the cow comes in from the yard, she drops off her information. So every animal is measured and monitored as an individual, and they'll drop off their information. And this then comes into an app on your phone, and I suppose what is that information and how can farmers benefit of it? Basically, typically there's 2 modules within SenseHub. We have reproduction and we have health. So within reproduction, I suppose the main components really are, it'll tell you the optimum time for insemination, tells you the optimum time for conventional semen, and also for sex semen timing. When a collar is on a cow from the day of birth, the pre-breeding starts the day of birth, or the day that the cow calves. So I always say that's one that often gets forgotten about. It's huge value. It adds huge value. We all have the cows that slip through the net and they only get 1 straw, and unfortunately they're often the cows that leave the yard that year. Then in terms of health, health measures the behaviour again of every animal. Every animal is seen as an individual, and when an animal moves away or deviates away from her normal behaviour, it would give you an alert on your phone. And the illnesses that we see be picked up would be the likes of LDAs, RDAs, pneumonia, E. coli mastitis, and milk fevers. So again, that's, I suppose, monitoring collars are very much, as I said, our core product within SenseHub. But our SenseHub ecosystem has much more, and we're continuously adding to it. Back, I'm going to say about 3 years ago, we acquired the Sabre brand. So some of you may have been familiar with the Sabre drafting gate or Sabre milking technology. And we acquired Sabre because we've seen the opportunity to develop further and add more information into our SenseHub ecosystem. So with that, we launched last year our SenseHub inline somatic cell count sensor and also our inline Milk Plus sensor. And so again, these products can all work standalone, or you can have them all joined together. But the somatic cell count sensor is essentially a California milk test that takes a sample of milk, mixes it with reagent, and gives a reading of that individual cow's somatic cell. We have 2 drafting gate options as well. So for example, if you have a cow that has a SenseHub collar, and we're talking about optimum time for AI, you can set it that the cows will draft out and they'll be in the pen for you after every milking. We have 2 options with our drafting systems. We have, they can work off the SenseHub monitoring collar, but also we do have standalone EID gates. And then finally, SenseHub Young Stock was the latest product that we brought to our portfolio last year. And it's a small ear tag that can be put in the calf's ear from the day of birth. And essentially it measures suckling, rumination when the calf starts to ruminate, eating, and activity. And activity is the one that really shows the behaviour. So we have it on a number of farms here in Ireland. It's really interesting to see. The tag can stay in the calf for the lifespan of the collar of the tag. So at 365 days of age, it'll switch into SenseHub dairy. So farmers can put it in the calf, and then you have a full profile of that animal for its whole life.